The following is brought to you by VerticalVet. Rethink your GPO.
Hello again, Vertical Vet family. I am Dr. Ernie Ward, Chief Veterinary Officer for Vertical Vet, and I am so excited about today's Vet Med School. Today, we have a very special guest from Zoetis. In fact, I can't wait to introduce you in just a second, but Zoetis is really behind a lot of changes in diagnostics and how we use them as veterinary practitioners. And one of the things that they're employing as well or better than anybody else in the world is the use of artificial intelligence. And so today, I'm really excited to introduce you to Dr. George Daniel. Now, he is the Director, U.S. Diagnostics, Veterinary Professional Services, Corporate and Specialty for Zoetis. I mean, that's a mouthful, but that's a lot to talk about today. But he's originally from the Twin Island Republic of Trinidad and Tobago in the Caribbean. He's a 2005 graduate of St. George's University and completed his final clinical year over at Auburn University. And I got to remind everybody, go dogs. Dr. Daniel spent over a decade as an ER clinician in emergency small animal practice, and over that 7-year period, he held positions of either the medical director or chief of emergency at a 15-doctor, 24-hour ER specialty referral practice up in Massachusetts. That's a big change from the Caribbean. Dr. Daniel then moved to the industry in 2017, first working with Abaxis and, of course, later with Zoetis. He is now one of the directors of the U.S. Diagnostics unit, and he leads the corporate and specialty diagnostics medical team. Dr. Daniel, I am so excited about this conversation today.
So am I, Ernie. This is awesome. Thank you for this opportunity. I'm really excited about it. And I have to counter War Eagle.
Of course. We'll see when the football game starts. But regardless, the reality is artificial intelligence, machine learning, those are terms that we hear every day. And we've had other guests on the show, talking about the applications maybe in imaging, such as radiology and so forth. But I think a lot of us are now starting to understand it's being applied broadly. And one of the areas that we really want to touch on today is how can this help us with diagnostics, with testing, with maybe even allowing us to interpret things that we couldn't envision interpreting 10 years ago, whether it's predicting certain disease states that might be just emerging, or to help us guide when we're making those diagnostic decisions for what to monitor for. So I guess the natural start of today's conversation is in the most simple terms possible, because I'm not a computer expert. What is artificial intelligence?
Yeah, well, Ernie, that's a great question, right? I am not a computer expert either. I'm a veterinarian, but I can take a stab at trying to give a definition to that commonly used term now. So first, a little background. I mean, the utilization of AI in everyday life is becoming more and more commonplace, right? From your smartphones, identifying your face or your thumbprint, to facial recognition algorithms for your smartphone, or even like in a medical setting where your physician is using an artificial intelligence algorithm to interpret pathology in, say, a mammogram, right? So we're also seeing AI coming out in veterinary medicine as well. And you mentioned in radiology, that's one of the areas where we're having a real explosion of AI technology. But it's not always welcome with open arms in whatever industry it comes into. People have concerns. They worry that their jobs are going to be taken by these androids and computers. And rest assured that AI has been around for a while. It is getting better. And it's making our lives more efficient and easier, especially from a medical perspective. So yeah. I think that it refers to a concept where an algorithm is performing an activity that would normally have human intelligence making a decision, and we're replacing that with this machine type learning.
Yeah, and I want to get into, again, I want more details, but I think in general terms, the way I understand it, I mean, this has been around for a long time. It's just the next progression, if you will, of how we interface with computers. And I love your example of saying, guys, it's all around us already, whether or not you use your iPhone to unlock it by facial recognition, or your physician might be leaning on artificial intelligence to say, hey, you might want to take an extra close look at this area, right? I mean, it's ubiquitous around us. But again, explain to us, okay, I get all that, it's there. I don't know how it works, but when we use the term artificial intelligence and machine learning, I mean, they do have specific definitions, and maybe help guide us through understanding why this is important and why vets need to understand it and not fear it.
Yeah, absolutely. I got some slides here that may help to elucidate what we're talking about here. All right, so artificial intelligence refers to, like we said, algorithms that are performing activities that would normally need human intelligence. So there are really two different types of algorithms. One is called superficial machine learning, and the other is called deep learning. The goal between the two is the same, however. The way that they're developed and the way that the AI is trained is what differs. So let's start with the line on the top there, the superficial machine learning. That's a branch of AI in which a human must manually extract features from an input, which is in this example is a cat. So the input is a cat. So someone has to take features of this cat and then teach the algorithm to recognize those features. When they put them together, then we have the output of the machine determining that this is a cat. The deep AI learning is using convoluted neural networks, right? And that's a neural network. It basically is a machine design that models the human brain. So these algorithms are inspired by the human brain, and they're used to learn from massive amounts of data to accurately imitate how a human brain works. And so in that case, on the screen, you can see that you have the algorithm itself is doing the extractions of all these multiple features to give you the final output. How the deep AI learning is trained is that we break the actual image down into tiny little fractions, right? So rather than having the superficial learning case where you have a standard cat and some person has taken okay, this is a picture of an ear, here's a cat's eye, and we put that with a paw, and when we put all of that together, we can identify that's a cat, right? So that would be the superficial learning. If we're talking about the deep AI learning, that is going to involve a much more complex set of features and functions that we then break down into tiny little bits. And these tiny little bits or features can then be reassembled by the AI itself to give you the final object of the cat. The reason why this is different, Ernie, is because the deep learning is using thousands of different facets that it's paying attention to. So it's much more, it's much better able to identify different and variations or presentations of whatever it is that you're trying to look for. Let me give you an example of that. I'll skip through here, and you can see that, okay, we have this cat broken down into all these little facets, so we can identify this as a cat. We're using deep AI learning here with the thousands of different points. We're getting into aspects of the cat that, if taken by themselves, you wouldn't necessarily, as a human being, be able to tell that this is in fact a cat, right? Because we've broken this down almost to the pixel level. And it's those multiple pixels that are then reassembled into the final object being the cat. Does that help to explain the difference?
It does. Yeah, and George, again, if you've followed me over the past 20 years, I'm a fanboy of Dr. George Lakoff, who's the guy who developed neural networks in general, right? So, I mean, the guy is still due a Nobel, in my opinion. But again, out at Berkeley, these people were saying, okay, how does the brain assemble anything, an image? And in his famous book, Don't Think of an Elephant, right there, it just says, hey, you thought of an elephant. And these neural networks are important because the only reason I want to focus on this today is what we are creatures of pattern recognition, right? So we are really good. And all this is recognizing that, wow, when there's this feature of the claw compared to this size of an eye with a fluffy ear, well, if I put all those things together, thousands, millions of things, then that's a cat, right? And this is the difference, because in the old days, we would take a picture of a cat, we tell the computer this is a cat, and then it would figure it out. Now we're to the next level. And the reason this is important to me, Dr. Daniel, is the fact that, okay, that's a visual image, but what about when we look at like test results? What do when we look about analytes and different, progression over time? I mean, visually, I get it, right? But I think we're now getting quickly into an era when we go, okay, that's great, but we can do better. We can like analyze 5 years worth of urinalysis on this cat, right?
Yeah, absolutely. This can be applied to many different functions, right? So a deep neural network, it basically just analyzes data with learned representation to in the same way a human being would learn by repetition and being taught what the correct way is. So if we apply that to any data set, we can then use that deep neural network power to be able to streamline work that would normally have to be done by a physical human being. So no longer do we have to have, in the case of a clinical practice, no longer do we have to have a technician sit and look under a microscope to try to identify parasites on a fecal sample, when we have artificial intelligence that can identify those fecal parasites with the accuracy of a board certified clinical parasitologist. I
Yeah.
mean, that's a huge game changer.
And one thing too, so Vertical Vet family, you're out there listening, you're going, oh, that sounds great, but this sounds an awful lot like the Terminator, and I don't trust these things, right? And I get that. But remember, what's really happening, in addition to all the learning that's gone behind the scenes, they're alerting us, right? I mean, when your radiologist is reading your wife or your partner's mammogram, they're not saying it's positive or negative. They're saying, here's an area you might want to pay closer attention to, right? I mean, so I think there's tremendous value to synchronizing our efforts, right? To collaborating with technology. And I think that if you're sitting out there skeptical, I get it. But at the same time, you're also using your smartphone in 1,000 different ways that are using AI. So, it's not nearly as scary and it's not going to put us out of business. It only makes us better, in my opinion.
It's a tool to make you more proficient. It's using high accuracy, analytic data power to make your practice function more efficiently. So,
Okay. So again, I love you. We've talked about artificial intelligence in general and the superficial machine learning, but okay, give me some examples here. Like, what is Zoetis doing to make this stuff come to life?
yeah. So, well, we have a product called the Vetscan Imagyst, which is, I'm really excited about AI on the whole, but I think, Ernie, maybe 10 years from now, in the same way that 20 years ago, not every practice had a hematology or a chemistry analyzer, 10 years from now, every practice will have some sort of digital cytology scanner in the practice. It's going to be like a mainstay of every practice. So the Imagyst is at the crest of that wave. We are at the tip of the spear with this product. It is basically bringing to the practice the power of artificial intelligence, along with the ability to utilize the cloud and get information to board certified practitioners very quickly. And so it again is changing the way we practice medicine.
Right. And again, if you're most of our Vertical Vet family, Dr. Daniel, they're independently owned. Many of us are in smaller areas, and I'll never forget when suddenly we were able to do digital radiography in our little clinic in Calabash, North Carolina, where our main facility was, and suddenly I could send this off through the internet. We didn't even really, I mean, these were slow transmissions, but I could get like a result back the next day. But today, I mean, Zoetis is offering speeds that are quite remarkable. I mean, explain to us how this cloud integration and being able to get a board certified review. I mean, I think a lot of people need to hear this more often.
I totally agree with you. I'm screaming it from the top of every mountaintop, right? So I think I have a slide here that may help to add some visuals to what we're talking about. So the Vetscan Imagyst is a multi-use digital platform that has currently 3 indications, right? We've got 2 artificial intelligence indications, and then we have the third indication is a standard cytology reading, where anything you can put onto a glass slide, you can now send out to a board certified specialist for evaluation. And we have a turnaround time we guarantee of about 2 hours. Right now, the turnaround time is about 30 to 40 minutes for cytology samples. So that is huge think about what that's going to do for your practice model. As far as the artificial intelligence portion is concerned, we've got AI on the fecal platform, which can identify 6 of the most commonly found intestinal parasites in dogs and cats. And we've also got AI powering our blood smear platform. So now in 10 minutes, you can get either a full fecal analysis or an artificial blood smear analysis that's going to look for things like validating white cell counts, identifying the presence of nucleated red cells, and looking for the presence of platelet clumps. And you can get all that information in a matter of minutes using this powerful AI. We've also got some published data on the fecal platform that shows that the accuracy of this device to be able to identify these parasites is equivalent to a board certified parasitologist. So this is huge from the way that you practice every day. No longer do you have to have someone sitting over a microscope. You can have your technicians doing things that earn your practice money or that are helping other clients, while the digital artificial intelligence is going to be doing the manual labor.
Right. And there's one thing I want to just bear repeating here. And the fact is that the hardware is actually not the rate limiter anymore, right? So, I mean, these devices, it's actually now being able to transmit and evaluate. So see, guys, if you invest and have this equipment today, this only expands. That's the beauty of this, right? I mean, I think that too often people are like, well, I'm going to wait till they upgrade it. I'm going to wait for version 2.5 or whatever, right? That's not exactly how this works anymore. I mean, like, again, go back to emphasize why being cloud-based actually changes the way you view your hardware.
Yeah. So this is an expandable model. It's a multi-use platform. It's been around for just about a year and a half, and we already have 3 indications. We're going to have additional indications coming within the next few months to the next year. So there's no need to wait. Get one now, and it's expandable. So there's no new material that has to be purchased. It's simply a digital switch that's flipped, and you can have the additional indications as we release them moving forward. It's really a game changer.
It is. And again, Vertical Vet family, you know me in the business world, right? So that is where, I think I first became known to most of you guys. And this is an opportunity. Back in our day, I mean, come on, Dr. Daniel, you were not around. You're too young for that. But we had to upgrade our hardware every couple of years. And that was
I remember that.
financial burden, because
Yep.
again, the analyzers changed. Internal mechanisms changed. The way they use different solutions or reagents changed, right? We're now saying, and again, we're limiting it to what he said, putting on a slide, right? So that is the limiter for this particular device. It doesn't
Correct.
matter, right? If you can put this thing on a slide, that image is going to be evaluated more and more robustly, accurately, precisely, broadly, as long as, you can keep transmitting images. And in fact, the other thing too I want to point out, and it bears repeating, the more data, the more samples that you get, the better your product becomes. Maybe explain that as well.
Exactly. So, this device is a learning device. We are not learning from your samples. We are teaching the device the gold standards of what things are supposed to be, breaking down to all those pixels. So we're getting the gold standard of image recognition for all of the substances that we're trying to look at. There's a slide right there that we can pull up to give us an example of what we're talking about. Okay, so guys, so here's a quick test. So this is a centrifugal fecal flotation that was done on a dog with diarrhea in a sugar solution. And so when looking at this image, do you think these are parasites? Especially the one
Wow.
circled in orange there.
Wow, this is tough.
Yeah, it's a tough question. But the deep AI learning platform of the Vetscan Imagyst is going to help us do that identification in a matter of minutes, right? So we can tell from what the analyzer can assess. I'm trying to get the slide to advance here. There we go. It's scrolling in there. And we get the deep AI learning moving to work here. So
Wow.
you can see that there are actual Giardia cysts, which, as you know, is a common cause for diarrhea from an infectious standpoint. And so it can be appreciated that many of the cysts appear vacuolated and have characteristic half moon shapes.
Wow.
That's due to the sugar desiccating the parasite, right?
Yep.
So this is something that would commonly be missed by a technician. And they say, no, that's
I
not.
would miss that, Dr. Daniel.
Yeah, or a veterinarian. Yeah.
Because I mean, we know how fast we're having to work. We're scanning these slides so quickly. I'm just discounting that. My brain can't analyze that 50 million times or whatever it just did. Amazing.
Exactly. Again, making your practice more efficient. So how about a blood smear? On this slide, you can see lots of red cells, some platelets, even a polychromatophil, which is another term for a reticulocyte, down at the bottom of the image. But what are the nucleated cells in that orange circle? Can we tell? I'm not going to put you on the
Wow.
spot, Dr. Ward.
No, I'm not even going to venture a guess. Wow.
Give the
Help
folks
me
a
out.
chance to try to answer that. Yeah. So what we're seeing here, it's another really tough question, right? But again, the deep AI learning is going to come to the rescue to give us an idea of what it is exactly we're looking at. It's zooming in here, and here we have the AI taking things apart by pixel and reassembling them and determining what it is we're looking at. So what we're seeing here is that we have a nucleated red blood cell on the left, which in higher numbers in the face of an anemic patient obviously would indicate regenerative response. And the cell on the right is actually a lymphocyte.
Oh,
But
wow.
I
Totally
mean,
missed
come
it.
on, they look almost the same.
Totally
Unless
missed
you're a
it.
pathologist, yeah, the average practitioner is not going to be able to identify this accurately, right? So having the power of these tools at our disposal at the point of care has made things a whole lot easier for the practitioner to understand how best to utilize their resources. And it makes your practice much more efficient by utilizing the power of artificial intelligence and harnessing that also with board certified human recognition at the end of the day. So say, for example, you ran one of the AI modules, right? You ran on either a fecal sample or you did a blood smear using the AI, and you don't believe it. You don't
Yeah,
believe that was a
right.
lymphocyte. I don't believe it. I want to get a board certified clinical pathologist or parasitologist to weigh in here. Just with the press of a button, you can get a board certified report within 2 hours. Like I said, right now we're at about 35 to 45 minutes, and you can get a human being reading that same sample. And most of the time, they agree with what the images said. They were
Yeah.
like, yep, this is in fact a lymphocyte, and that was a nucleated red cell, and that was Giardia. Yep, just like the device told you. And you get a full report that would normally have taken you days to send out a glass slide and get a report back. So
That's remarkable. And Dr. Daniel, I did see some data that supported that it's almost never happening. Like literally the board certified pathologist is almost in complete agreement all the time. I mean, it's remarkable. But what I do like about this, number one, is the speed, right? That changes our workflow dynamic, because if I can get these reports back quickly, well, that changes my assessment and treatment potentially, or follow-ups or whatever. But get back to that original. Okay, so I'm scanning that for, again, it's a diarrheic dog, and I wind up looking at the slide. I didn't catch that. How quickly does that Giardia cyst pop up? Just if I'm in the clinic right there, is that within minutes, or do I take an hour? How quickly did that happen?
So the workflow, so it sounds like a workflow question, right? So what's the workflow for getting to the point where you can identify on a fecal sample?
Without having to go to the board certified pathologist, it's like, whoa, you missed Giardia, guy. Here, go back.
So the prep from actually collecting the feces, we have specially designed containers that limit the amount of exposure that you have to the stool. So it's got a little scoop on the end. It's got a pre-mixed vial that contains this suspension solution, whether it's zinc sulfate or Sheether's sugar solution. So you take that scoop of poop, put it in there, put it in a centrifuge for 2 minutes, and then you can blot it out onto a slide. And so in total, you're looking at about 5 minutes of tech time, maybe less than that, and 10 minutes. The balance of that 9 to 10 minutes is scanning time. So a total of less than 15 minutes, you can have a full fecal report at the accuracy level of a board certified clinical parasitologist in less than 15 minutes. So that's, I mean, I think that's comparable to currently what most people are doing for their fecals in-house.
Absolutely.
And as far as send out is concerned, the nice thing is because we're scooping just about a gram of stool, right, which is about the size of a sugar cube, and the device is actually giving you fecal egg counts per gram.
Right.
That's a fecal egg count, right?
Yeah.
Even the reference labs aren't doing those things that often, right? It's hard to get a reference lab to do a fecal egg count on a routine basis.
Yeah, unless you're a large animal practitioner, right?
Unless you're a large animal practitioner, you're getting that in 15 minutes or less with the Imagyst at the point of care. As far as the blood smear is concerned, we were all taught in vet school that you need to make a blood smear with every CBC that's run so you can assess things like morphology. Now you can actually do that. You're completing that blood smear assessment. You're taking your CBC result from your CBC analyzer and compiling that along with the Imagyst blood smear in less than 10 minutes, and you have a full CBC looking at morphology and cell counts as well.
Right. And what I love about this, so, I came up in the era when we went from reference lab, everything got sent out, to then doing it in-house. And, I was the biggest advocate for that because I felt like it really enhanced the workflow. I got clients' answers quickly, right? So, most of, if you go back and look at our old videos, it was all built around how quickly could we get those samples done, the fecals, the blood, the urine, right? So it was all built around, like, our exam was back-ended in synchrony with doing the blood tests and all the diagnostic testing. We're now back to doing that way, right? We can literally get, and I'll tell you the reason why I'm a big fan of this, guys, is that when you've got that client in front of you, right, and there's a diarrhea or there's just malaise or fever, whatever, right? If you have to send them home, and even if you call them back later that evening somehow, there's a big disconnect in treatment, and a lot of things can happen. If you can satisfy that answer right now or give them as much information as possible, I'm telling you, your compliance rates go up, you're more profitable, your revenue streams are better, you're able to do that additional diagnostic test that, oh gosh, now we need to do this based on these results. I think, again, you use the term game changer. I'm going to challenge it a slightly bit. I think we're just back to the old game in a way, but we got a better bat.
It's a more efficient game. Yeah, definitely more efficient. And Ernie, your point is absolutely correct. Think about it from the client's point of view. When you send that sample out, whether it be a biopsy, a fecal sample or whatever, and it's gone to the reference lab and it has to come back, what is that client doing in that period of time when they're waiting for those results on their adorable fluffy baby? They're worrying. They are stressed, right? In the case of a diarrhea case, they're dealing with the diarrhea until you can come back with a definitive diagnosis that says, yes, you can use a coccidia stat because it's coccidia and not something else, right? So let's think about the value to the client as well. And I think that really tries to drive that message home that this is something that we need to, this is a new way that we need to approach this, or an old way made more efficient by the use of this multi-use platform.
Yeah, and again, the artificial intelligence is what's changing this game. That's the better bat, if you will, if you're playing baseball. But getting back to this too, I think we have to be honest with ourselves too, Dr. Daniel. Look, I would read the slides, I would read my blood smears, my fecals, and honestly, guys, if we're being truthful, it's like 10 seconds. And there's no, unless it was jumping out that this was Giardia, I might have missed it, right? Now, then we go back to, well, I'm just going to treat it symptomatically. So I get that, right? So I'm not saying we're wrong all the time, but this is better. This is more thorough. This is actually, I would have to argue the more moral and ethical choice. Because look, I know how busy, and you were in the ER for a long time. You're pressed for time. You can't tell me you're sitting there spending 3 minutes, driving back and forth. You're kind of like, okay, get a
time is of the essence. And, when we were in vet school and tech school, you could walk down the hallway and find a parasitologist or a pathologist to give you an answer on a question that you have. You have that facility now with the Vetscan Imagyst, right? Which is, this is what we need.
And you're right. Literally, it's the push of a button and you get a board certified parasitologist or whatever review, right? So I think this is important. Okay, so where else are we headed with this? Okay, so we've got the 3 main use cases, right? So we've got, fecal floats, we've got blood smears, and keep going.
Ernie, you're trying to get me in trouble. I'm not supposed to talk about what's coming down the pipeline. But if you can just use your mind's eye, your imagination, I'm sure you can think of a number of ways. Like we
Yeah.
said, you've gotten fecal egg counts. Think about all the applications of that. Anything that you can put onto a slide, a glass slide, basically can be read. So think about all the implications of that. There are multiple things that this platform could potentially do. And like I said, we have other indications that will be out within the next several months, and even more as the year 2023 rolls around. So
It only gets, it only
yeah, I
grows.
wanted to make sure that everyone, all the Vertical Vet members, know that you can. We're not talking about something in the future.
right.
We're talking about right now. You can talk to your Zoetis rep right now and find out ways to get an Imagyst into your practice right now. So, with no out of pocket cost up front, and then there's an entire team of Zoetis people that come in to help train your staff as well, which is a huge plus. We're not just putting a device in there and walking away. There's a team of people, including professional service veterinarians, including technicians, certified vet techs, that will come in and train your staff on how best to utilize this analyzer.
Okay, so you went there, so I'm going to go there. Let's talk about the cost for this, right? Because I think that sometimes people see stuff like this, they go, that'd be great, but I'm not in Manhattan. I'm not in Los Angeles where people have money pouring out of their pockets. I'm in rural Idaho or Wyoming, Wisconsin, wherever. Explain the cost structure, because again, Zoetis Diagnostics is doing some of the most innovative pricing modules or strategies I've ever seen. Maybe talk us through some of those.
Yeah, so again, that's outside of my wheel well, but I can certainly tell you this. I can certainly tell you that some of our rural customers are some of the biggest customers as far as the Imagyst is concerned. It's because they don't have access to twice-a-day pickups from a reference lab or a trusted specialist in the neighborhood that they can use this technology, and 24 hours a day they can access board certified specialists and use the AI to make their practice more efficient. From a cost perspective, the AI modalities currently, both blood smear and the fecal, are about $10 to $12, right, for that 10-minute run, 10 to 15-minute run. And then the send out cytology portion is about $70. That's for a full cytologic examination by a human being. Now, we don't penalize you for doing the AI first and then adding on the human specialist after. So it's one cost. For $70, you can submit 4 slides from 2 different sites on that animal. If you said you wanted to do AI first, right, and then we said that's $10 to $12. If you then decided you wanted to add on a human being to validate or verify what the artificial intelligence had told you, it's only $58 to make up to $70. So you're not penalized for doing AI first and then adding on cytology after. And again, these devices are coming into your clinic. There's no upfront cost. We can get them to you, get them landed, get you trained, and then the spend is over a few years. There's some very, very low minimums that you meet, but we've done these pilots now with a number of different organizations, and they tend to be huge successes. And the management teams are always amazed at the uptake of the private, the individual clinics with these analyzers, because they didn't know this was a need.
Yeah.
Right. We have clinics that we went into and they were like, no, we send everything out. And then we put an Imagyst in there and they're like, oh, no, we should be doing everything in-house, because over the pilot period, they were just using it multiple times a day. And
I've heard the exact same feedback from the vet clinics that I know that have used it. And again, they're kind of going, okay, at first, everything's working fine. We don't really need this. I mean, okay, but if you guys want to put it in here and show us what it does, we'll entertain that, right? And then literally like 2 weeks later, they're like, oh my gosh, how can we live without it? And I think that's what's going to really transform your practice, because once you see the speed of this and once your workflow does adapt to it, you're going to say, okay, this is essential now. It's not I'd like to have, it's a a need to have. And I'm telling you, what I'm so excited about and why I'm trying to get as many Vertical Vet members to join now is it's not going to be obsolete in a year. It's only going to expand in utility. And again, I know we'd love to be able to share some of the stuff that's exciting, and I've got my best guesses on, but the reality is if you start today, you can start using it, getting familiar, whatever, and then who knows, in the next couple of months, you may suddenly go, oh my gosh, there's this new thing that's very, very exciting. And it's only going to get exciting. Real quick, before we have to go with you today, could you just, I know you maybe had an image of the unit itself. Could you just maybe show us that and walk us, just tell the Vertical Vet members what it looks like? Because maybe they're thinking it's a big, takes up a whole room, but I think when they see the size of this thing.
Right now, that slide that's up right now, you can see what the device itself looks like. It's really tiny. That's a Grundium scanner, which is a human-grade medical scanner, and it's sitting right next to an iPad, so you can get an idea of the scale of the device. It's about 8 inches by 8 inches by 8 inches in terms of its footprint on the table. So we have practices with multiple images, 2 to 3 images lined up on the table. Because they're so small and neat, you can have multiple images to run multiple to run multiple tests at a time. And I really think that like you said, Ernie, now is the time. I know you and I will be doing more of these types of virtual events over the next foreseeable future, to make sure that your Vertical Vet members understand that this is technology today that we need to harness, that will help you practice better medicine at the point of care today. And so look out for that. We're going to have more of these conversations, both virtual and live. And I really think that this is the time to reach out to your Zoetis representative and find out how to get this analyzer in your practice with no upfront cost.
Yeah. And again, guys, there's just literally no risk here. I encourage you to look at it because this is the future. There's no putting the genie back in this bottle. I mean, this is going to be how it moves forward in medicine, and it's only going to get better. And and again, so if you are concerned or skeptical or whatever, I would just say first and foremost, experience it for yourself. I mean, I'm lucky to have been sort of watching this in the progression over the years, but I can tell you right now what Zoetis is doing with Imagyst, it's next level. Like, it kind of is mind blowing, and I don't use those words lightly, Dr. Daniel. I mean it truly, and I think that if you would just actually call up Vertical Vet, let us get you in touch with your Zoetis rep, let them come in and just talk you through it. You're going to be just as amazed as me. So, any last bits of advice or anything you want to tell the Vertical Vet members? I mean, I think you've done a great job, but anything else you want to leave them with if they're sitting on the fence going, maybe not?
I appreciate it, Ernie. I think that these kinds of conversations, we need more of them. If there's any skepticism at all, ask for a demo. Ask for a demo, right? Have them come in and show you the analyzer and show you how it works. Most demos often end with the analyzer staying in a hospital, right? So the people want to just keep the analyzer there. But this, don't miss this bus, guys. This is like Ernie was saying, this is what we've always wanted. From the standard of the high quality medicine being brought to bear at the point of care, improving the value of the service that we can provide for our customers using, top tier equipment. The Vetscan Imagyst is the way to go, and we need to get a Vetscan Imagyst. Everybody's going to have a Vetscan Imagyst in the next 10 years, so you want to get ahead of the rush and get one now.
Yeah. And again, just the more experience you gain with it, the better you're going to be for it. Again, Dr. George Daniel from Zoetis, I can't thank you enough for your time and expertise and really enthusiasm for making practice better. I mean, this is, as you mentioned, elevating standards of care. And I think at the end of the day, anybody in the Vertical Vet family, that's all we really want to do. I mean, we came into this profession to help the pet patients that we love to serve. And this is just one of those ways that enhances it. So again, thank you so very, very much.
Yeah, Ernie, I think people respect your medical acumen and your business acumen. I mean, if you say that this is something that you would want in your practice, I think that speaks volumes as well.
I need 2 or 3, just like we used to have in the old days. So we know the workflow. Well, Vertical Vet family, again, thank you so much for taking your time with us today. This is one of those conversations that you can take back and put it into action, right? I mean, Zoetis and Imagyst is changing, revolutionizing the way we do diagnostics in our clinics. And so again, if you're in one of those independent areas and you don't have access to specialists down the hall, you do now. It's literally a push button away, and the costs are really affordable. So I don't think this is going to be one of those technologies where we go, gosh, I wish I could afford it. This is something that any practice can implement today, no matter how large or small. So again, if you want to find out more, you can contact us at VerticalVet, or you can certainly reach out to your Zoetis rep. But we just want to get this in your clinic. If you demo it, I think it's going to be just like Dr. Daniel said, it's going to stick around. So on behalf of the entire VerticalVet family, thanks to Zoetis for sponsoring this. We will talk to you soon. Bye, guys.